Dr. Bove is a man of ultimate honesty and integrity.
Amazing surgeon, phenomenal administrator.
A wonderful husband, wonderful father.
The ultimate gentleman, an amazing teacher.
The most well-respected congenital heart surgeon in the country.
I'm a New York City kid. My very first recollections as a child were living in Manhattan in a high-rise. I went to college in Massachusetts at Holy Cross, and then went to medical school back in the state of New York at Albany Medical College, which was a great choice because it was a very small medical school. And I got my first association there with heart disease in kids.
We met between his first and second year of medical school, and we were married between the second and third year. That was a long time ago. He was very idealistic and very energetic and very focused on learning everything that he could possibly learn. And I can still remember how excited he was when he came home and said that he'd just seen this big miracle of this baby that had been blue before surgery, and that after the surgery, the baby was all pinked up. He was just very excited about that and knew right then that that's exactly what he wanted to do.
We have known each other since we were residents here at the University of Michigan in the 1970s together. The young Dr. Bove did not have gray hair, had the same thoughtful intensity, passion, compassion, as well as talent.
I left to do additional training in London, England, in what at the time was perhaps the foremost congenital heart center in the world, the Hospital for Sick Children at Great Ormond Street in London. And the experience that I got there was so different than what I had had during my training here, because they approached congenital heart problems very differently. And to them, the extremely complex was commonplace. And so when I started out, I really wanted to try to do something, not just to sort of keep pace, but to set the pace a little bit.
I very much encouraged his arrival at Michigan and choosing Dr. Bove to head the pediatric cardiac surgical program, because of his excellent training, his wonderful skills, and his synergistic approach to other physicians.
We approached it together, and we wanted not just to be innovative, but to advance the field, to look at certain defects, hypoplastic left heart syndrome, perhaps the most notable, that certainly at that time there was essentially no treatment for, and to say, let's see what we can do. Can we offer something?
I think what makes Ed such an outstanding surgeon is his innovativeness and his willingness to push the envelope, to develop these techniques and skills that can be applied to some of the most complex patients in our field.
He encouraged the development of a team between different health professionals that took care of the patients. That involved the cardiologists, the nurses, respiratory therapists, nurse clinicians. He helped develop a cardiac intensive care unit for children so that the cardiologists and the cardiac surgeon could take care of the patients rather than another group of physicians.
I came here in 1998 as a fellow in pediatric heart surgery. Dr. Bove was my mentor. The things that I learned from Ed in a surgical realm are basically everything. The important thing about what Ed has accomplished is that it's not just the things that he's done. Everything he's taught me goes into the patients that I take care of. The same with my other two partners who are also his trainees. And then all the other trainees, about 35 trainees that have come through here, are all out there saving kids as a direct result of Ed's training.
Dr. Bove takes mentorship incredibly seriously. During my years of fellowship training with him, it would be amazing. You'd go to the operating room and he would teach you a whole book chapter through the course of an operation. He really has taken a huge interest in every single trainee who has come through, making sure to improve upon their skill set, making sure that they leave this place surgically skilled, able to take care of congenital heart patients. And that mentorship goes beyond just how to throw the stitches. It's how to hold yourself in the operating room. It's teaching you leadership skills. It's guiding you in developing a research and an academic career.
Being a teacher and a mentor is right at the top of the things that I find really rewarding. I, from the start, never wanted to just go and be a surgeon, but I wanted to enable a team, to teach the future, to be able to innovate.
Dr. Bove is the most technically skilled surgeon I've ever seen. He does things here that other centers wouldn't even consider trying. Dr. Bove has advanced pediatric cardiac surgery in many, many ways. I think probably the one he's most well known for is the care of the single ventricle patient, kids born with half a heart.
We were told to take him home and that there was nothing that they could do. I never believed that. It was unbelievable. I felt like no one was listening because all these doctors and nurses were saying they were sorry, and I just knew that this baby was coming home with us.
Single ventricle kids before 1981 or 1982 had no operation. They all died. Around 1981 or 82, a new operation called the Norwood procedure came out. Early on, there were very few survivors, and Dr. Bove was one of the very few people that was able to get these kids through the operation.
When we met Dr. Bove, he had a calmness to him. He'd come in and he explained everything he was going to do, and his success rates, and Tyler's a great patient for this after he looked through all of his tests, and we had a lot of confidence he could do it. Tyler's a senior now in high school. All through his life, we let him play sports. We didn't realize that he had a gift for baseball. He plans on playing after high school if he can.
I hope that I can go play baseball at the University of Michigan. That's where I really would like to go to school and play baseball there.
It's hard to think that one breath people can tell you there's no way he can live through this. 17 years later, he's playing baseball in high school. But that comes down to making sure you find the right people to help you. His health and the way he's thrived through all his surgeries is 100% on Dr. Bove and the University of Michigan. They don't make you feel like he's in a bubble. They don't want to overprotect. They want everybody to try to live a normal life if they can.
During the period of the 90s across the nation, the average survival was about 40%, and at the same time he was getting about 75% survivals. And so he was able to show a lot of other programs that this operation can be done and with a reasonable survival. And now the experience centers have over 90% survival.
The surgery's never come very hard to me. I've always found that the easiest part of things. One of my favorite aphorisms is, if it's hard, you're doing it wrong. The hardest part really is to look at the whole situation and to say that this is really the best thing to do.
When we reconstruct these hearts, it's not really back into necessarily a normal anatomic, physiologic, normal heart. Sometimes the blood flows are all different, rearranged, replumbed. We're always trying to figure out what's the best way to do that. And so he's gotten involved with computer modeling using flow dynamics and all kinds of complex mathematical formulas to predict what's the best way to do these operations without actually having to do them experimentally on kids.
But it's not just what he has done, it's what he's encouraged in other people. Every single person who comes through this program has a research interest and mission as well, and he has been behind that interest as passionately as he is behind his own interests.
He has published some 300 scientific publications in refereed journals. He has written some 40 to 50 chapters on different types of congenital heart disease and cardiac surgery. He has given lectures, symposia, and centers throughout the country and internationally.
When he speaks, people listen, and I think one of his tremendous strengths is that willingness to collaborate, to share ideas with people who are from other institutions. And that's not something that is necessarily done easily or freely in many aspects of medicine. And I've been amazed at seeing what he has been able to accomplish in our children. And these children are now growing and thriving and leading wonderful lives and having children of their own.
I had my first 3 surgeries in Grand Rapids. I went to the University of Michigan when I was 12. There was some unique things with my condition, and they needed somebody that would take a risk. And I remember seeing Dr. Bove. I was kind of awestruck by him, knowing that, wow, this guy's gonna go in and fix things for me. I wanted to be a mom since I was a baby. I've had every doll and carried her around and couldn't wait. And my doctor in Grand Rapids was saying, I don't know if this is going to be in your path. And my mom had always said, the doctors had said that forever. She won't be able to do it. Her body won't be able to. Dr. Bove replaced a valve, and I recovered quickly and came home and started the follow-up and the process so that eventually I was going to be able to be healthy enough to have a baby. We took a couple months, but it happened. I had an ultrasound at 8 weeks, and the nurse looked at me and said, I have something to tell you, and I thought she was going to confirm, yep, you're pregnant. And I'm like, yep, okay, tell me. You're going to have 2. On July 21st, 2010, we welcomed Sienna Nicole and Georgia Grace to our life. My life is perfect. I have the most amazing husband and the 2 most amazing children, and it's everything I ever wished for and hoped for, and I couldn't be happier. What I owe to Dr. Bove, I don't even know if I could put into words, because he got me to a point where not only could I carry a child, I carried 2.
Wow. Oh my goodness, yay! I'm very proud of that fact that I think we have pushed that envelope appropriately into repairing complex congenital defects. Perhaps there's some bravado in there as well. If somebody tells you it can't be done, you don't want to necessarily accept that. But I do think it's trying to understand the most you can about whatever that heart defect might be and realizing, yeah, I do think it can be done.
He has a presence. There's this aura about him. He's incredibly funny. He is charming to a fault. I think the best things that I've gotten to enjoy of getting to know Ed is really seeing his relationship with his wife and family. I mean, that's what really shows you the type of person that he is, and you can tell that really they're the center of his life.
The first real long-term survival we had is a young lady who's now 24 years old. I lost touch with her over the years.
Linda Chambers?
Hi, how are you?
Linda Chambers?
Yeah, hi, how are you doing? Oh, nice to see you. What are you crying about?
I don't know.
He had the ability to keep moving forward against overwhelming odds. I don't know what it is inside of him that makes him want to move forward. It's determination, courage, self-confidence that it could be done, and probably hope, because these kids had no hope. Someone has to have it for them.
I just want to say thank you for saving my baby.
Well, you're welcome.
Thank you. You were wonderful.
That's all the thanks I need. It's right here in my arms. Doing heart surgery today is as exciting as it was 25 years ago. I'm still always filled with a sense of awe that you can actually open someone's chest, stop their heart, correct a problem inside, restart it, and have them go on for what you hope will be a vastly improved, if not normal, life. But it is still a feeling of privilege and awe every time you get to do it.
The role that he's played in my life is, he is so amazing. I don't know. A huge role. If it wasn't for him, I wouldn't be here. I wouldn't be able to have this wonderful life that I have if it wasn't for him.
There is no higher honor than to be regarded by those who you have worked with, as well as those you have cared for, and those you have educated, than to have a professorship in your name.
The only way that we can realistically raise money to support an endowed professorship is through philanthropic efforts. We need grateful families, colleagues to contribute to allow us to really build this professorship. To be part of the Ed Bove Professorship as a donor really opens doors to be able to be a part of the University of Michigan family. It really also allows one to align oneself with a leader in the field who has done so many tremendous things for patients and families across the world.
For those that contribute to the Endowed Chair, I certainly would like to let them all know how much it means to me. It is, in essence, the acknowledgement of a career of what you've done, and that others recognize that. It's humbling. It really is. But beyond that, how much it means to the congenital heart program here at the University of Michigan.
I think it's important for people to understand the importance of giving to this, because there wouldn't be these beautiful babies, there wouldn't be this beautiful story to tell, and we need people like him to do that.
I owe my life, everything.